Hello, my name is Lisa Cascarante, and today I'm going to be talking a little bit about intellectual disabilities, and at the end I will be focusing more on Down syndrome as an example of an intellectual disability, and provide a case study with an exercise prescription. So let's get going. So intellectual disability is a term used when there are limits to a person's ability to learn at an expected level and function in daily life. Levels do vary greatly when diagnosing intellectual disabilities because you can be very low functioning, you can be very high functioning, so it's anywhere from mild to severe intellectual disabilities. And it can also cause other areas of slow development, such as speech, communication, hearing, and vision. Some examples of intellectual disabilities you might have heard of are fetal alcohol syndrome, autism, ADHD, and then some genetic and chromosomal conditions such as Down syndrome. Epidemiology and pathophysiology. Not a ton of research has been conclusive on what causes intellectual disabilities. We know that there's a mix of factors that can contribute to the likelihood of having an intellectual disability. Some of those factors are just your genetics, the parental health and behavior, especially during pregnancy, any complications at birth, mother, any infections the mother may have, environmental toxins such as lead poisoning, and they can occur anytime during the developmental period and last through their lifetime usually. Most begin before a baby is even born, like I said, during pregnancy, but then sometimes it can happen after birth, whether that's because of an injury, infection, other environmental factors. The diagnosis includes two parts, and it's an IQ test and considerable problems in everyday functioning. So not only do you have to have the low score in the IQ test, you also have to have problems with adaptive behavior. The prevalence is higher among boys, and then it can be anywhere from around 8 to around 37 per 1,000 people diagnosed because the study that found this included both mild and severe, moderate, like all through the spectrum of intellectual disabilities. It included all of those. Intellectual disabilities can be autosomal dominant or autosomal recessive conditions. The dominant just means that a single copy of the disease associated mutation is enough to cause the disease. And contrastly, the recessive disorder is where two copies of the mutation are needed to cause the disease. So some examples for the dominant would be neurocutaneous syndromes, and then the recessive amino acid metabolism, Tay-Sachs disease, etc. It is very common to have comorbidities with intellectual disability. Some include cerebral palsy, epilepsy, vision, hearing problems, as well as speech and language problems, and many others. So for Down syndrome specifically, it's the most common chromosomal disorder. 6,000 babies per year, and 1 in 700 babies are affected in the U.S. It's caused by the presence of an additional copy of chromosome 21 in cells. This additional DNA can cause physical characteristics, such as the slanted almond eyes, kind of a flat face, like a divot in the palm, a stocky build, and then the developmental learning disabilities that could be anywhere from mild to severe. The prevalence of having Down syndrome increases as the mother's age increases. So the older the mother gets, when she is pregnant, the higher the likelihood that the baby will have Down syndrome. And then, like I said, the physical deficits and the biochemical changes can lead to multiple comorbidities. And as someone with Down syndrome ages, the healthcare need increases. This could be because of the multiple comorbidities, or just because of the age they have less ability to do things on their own. So the benefits of exercise are similar to those of someone without Down syndrome. They're just like everybody. They're like people with Down syndrome and people without Down syndrome have pretty much the same benefits for exercise. Some of these include improvements in aerobic capacity. This is more especially for people with Down syndrome because they have a decrease in cardiovascular and aerobic endurance. So with exercise, that becomes improved. Increased muscular strength and endurance, which is very important because of their low muscle tone, their joint hypermobility, things like that. It can increase their gross motor function. It increases the functioning and efficiency of the myocardium, so their heart health, because it's not uncommon to have heart problems, congenital heart disorder, when you have Down syndrome. It decreases cholesterol and blood pressure. And then I like to think of self-efficacy as like a big one that kind of includes a lot of different benefits. With self-efficacy comes improvements in adaptive skills, so the person becomes more independent, can do things on their own, they're more motivated to keep going, to be better. Just like anybody without Down syndrome, you want to be better, you want to set goals, you want to reach those goals. It increases their positive outlook on life, which in turn gives fewer cognitive and emotional barriers, which is super important. The exercise response. People with Down syndrome have a highly sedentary lifestyle. It's very common to be overweight, obese. So that might be because of the social and environmental barriers that they have to face, which are more than someone without Down syndrome. And their limitations and restrictions to the training are usually more than someone without Down syndrome because of their poor skeletal muscle development and just because of chronotropic incompetence. Many people don't think it's a good idea for people with Down syndrome to exercise because they're too fragile, but that's not the case. It is actually very beneficial, just like it's beneficial to someone without Down syndrome. And they're not too fragile. They do have low levels of work capacity and peak oxygen consumption, so it might be a shorter exercise bout for them just because of their aerobic capacity. And then they reduce bone mineral density, and exercise increases your bone density, so that'll help them improve that. As far as modifications go, I think a lot of it depends on the specific type of training that you're doing, just based on their activity level, based on their age. For example, aerobically, you can start with walking, and as it's tolerated, you can go to maybe a seated stationary bike, to cycling, to jogging, just depending on the progression, and this will improve respiratory and cardiovascular systems. I think it's super important to always have supervision, especially for beginners, especially for younger children, or for low-functioning patients. And then they respond better to demonstration as far as exercising. So maybe doing it with them, doing it before them, having pictures on machines so that they can see actually what it is they're doing and not just be told what to do. And then a support system is always super important. Verbal encouragement, motivation, all plays a role. And then just modification, things to keep in mind when deciding on modifications for exercise. Their hypotonicity, so their low muscle tone, their joint hypermobility, which leads them for increased risk of injury, and their atlantoaxial instability, which has to do with the hips. Those all play a role in modifications, depending on the specific situation. Medications. Down syndrome impacts the immune response, and so many different comorbidities arise. So gastrointestinal malformations, they're more susceptible to certain infections. Food intolerances like celiac disease is not uncommon. Congenital heart defects and hypothyroidism are also common. Dementia is also very common in people with Down syndrome. Some of the medications that I researched, there wasn't a ton of research to do when dealing with Alzheimer's and Down syndrome, but the ones that I found said gastrointestinal issues occurred, altered mental status, urinary incontinence. As far as depression and anxiety as a comorbidity, certain medications like sertraline, fluoxetine, citalopram were all given as prescriptions. For seizure disorders, anticonvulsants are usually prescribed, and the anticonvulsants sometimes control the symptoms from seizure disorders, but other times they exacerbate comorbid conditions. And then ADHD, it is more common in the children with Down syndrome than compared to the adults with Down syndrome. It's just not always diagnosed because of the other behaviors in children with Down syndrome resemble ADHD symptoms. And then some prescriptions written for those would be Adderall, Ritalin, Dexedrine. And then response to medication. Age plays a major factor. Just because the older you get, it's more likely that you're using more medications, you have more comorbidities, things like that. The adults with dementia and Down syndrome, exercise and nutrition were both recommended, especially when you're taking the donepezil as a medication. It does slow the heart rate down. Antidepressants, as well as exercise, increases the synthesis of new neurons in the adult brain. So they're learning more, they're able to take in more information, and exercise also boosts serotonin and endorphins. So the exercise with the antidepressants would be the best mix for that. It does increase the blood pressure. For seizure medications, light exercise is encouraged because it does affect coordination and dizziness. Attention deficit disorder, Ritalin, elevates the blood pressure as well as heart rate. And then it is recommended that medical clearance is received for certain comorbidities. Some of them are listed, just depends on the severity. So for the case study, we have Charles, who's a 12-year-old patient with Down syndrome. He suffers from low muscle tone, excessive joint flexibility. He is overweight and has neurological and developmental delays. He sometimes plays outside with his brother and sister. However, he does not actively participate in exercise and does not follow a nutritious diet. He has difficulty with communication and language development, and he has attention deficit disorder specific to Down syndrome and spinal asymmetry. So he's about to begin physical therapy to help correct the spine asymmetry, but he was also recommended to see an exercise physiologist. He does show early signs of generalized anxiety disorder. So for aerobic training, it's recommended for at least 30 minutes each day, 6 days per week. Light to moderate intensity, improving or progressing as tolerated. So maybe start with walking and swimming and stationary bike, and then maybe moving on to jogging, joining a soccer team, just playing outside in general at least will help with that aerobic and cardiovascular health. And then for the resistance training with supervision, we'll start out light and focus on spine and hip strength, muscle toning, and keeping in mind his excess joint mobility. It'll be 2 to 3 days per week with intensity starting light at around 40 to 50% VO2 reserve and increasing to moderate as tolerated. 30 to 45 minutes per day in bouts of 10 to 15 minutes. An example of a warm-up would be body weight squats with a medicine ball behind your back against the wall. For lower body, 3 to 4 sets of 10 reps. Leg extension, leg curls, squats, and lunges. Leg extensions and leg curls are beneficial in the machine just because the machine cannot control the weight. Squats, they affect a lot of parts of the body. They're always good. Lunges could help with coordination and balance. And then for upper body, 3 sets of 10 repetitions of bicep curls, assisted rows, push-ups, tricep extensions on the cables. All of these with supervision, and all can be progressed with tolerance. And then motivation is super important. So maybe a reward system for, in his case, paying attention, maybe repeating back instructions would be helpful. Performing the exercise with them so they're not alone, making sure they have a good support system, are all different motivational techniques to keep Charles motivated, to keep him wanting more, to keep him wanting to get better. All would definitely help. Thank you so much.